Welcome in. I'm Colette Wieland alongside Dr. Stephen Camarata. Steve is a late talker, parent of a late talker, and is internationally recognized for his child development work, particularly when it comes to speech and language. Today, we are wrapping up our conversation on common labels that children are given when their speech and language skills are a little different than their peers. Steve, some of those children might receive an intellectual disability label. What does that mean?
So intellectual disability means that in addition to learning to talk later and more, taking a longer time to learn things, they're going to have slower learning speed across multiple domains. So historically, this was called mental retardation. We don't use that anymore, because it's really got a negative connotation. So we use intellectual disability. But what it means is that the child is going to need extra time and extra support to learn not only how to talk, but other areas as well. So academic subjects, things like household tasks, just across the board, they're going to take a little more time to learn than other children.
Okay. What are some of the signs or early signs of an intellectual disability?
So one of the things that's really important is that you think about, when the child's not talking and they're learning to, it's taking them longer to learn vocabulary and things like that, are there other things that they're having difficulty learning? And so it's still not uncommon for somebody to misidentify a late talking child, particularly a child with language disorder, as being intellectually disabled. So the first thing for all these things is child is slow to learn how to talk. Okay, is it a stage? It is a symptom. If it's a symptom, is it, autism? Is it speech disorder? Is it language disorder? Some of the things we're talking about. Is it ADHD? And then one of the things you think about is intellectual disability. So is this just that the child's going to learn more slowly? Now, the thing that people can kind of identify with is Down syndrome. So people with Down syndrome, the majority of them have an intellectual disability, in that in addition to learning how to talk and learning how to say sounds, they have some motor differences and also some structural differences in oral architecture. So they have organic and functional speech disorder at the same time. It also takes them longer to learn how to read, how to do math, and so on. And so that's what we'd think of with intellectual disability.
Can a child have an intellectual disability without any other underlying medical conditions?
Sure, that's very common. So sometimes there's intellectual disability that's associated with, say, a genetic condition. For example, particularly boys that have Fragile X. Many of those children will have that genetic condition that then kind of cascades into reduced speed of learning across multiple domains. Certainly, we just talked about Down syndrome. People with Down syndrome have a medical diagnosis. But a lot of times, someone who doesn't have one of those things, they might have intellectual disability. And again, we just don't necessarily know the cause. Some of the same risk factors we had for language disorder, the same risk factors we have for intellectual disability, premature birth, birth trauma, and so on. These things have general developmental impacts. So there's certainly plenty of children who were premature, plenty of children who had temporary periods of oxygen, what we call fetal anoxia, and so on, that don't have any of these things, but there is a higher risk when those conditions occur that could be associated with the intellectual disability. And of course, like if a child has a sustained high fever, that can also be related to intellectual disability. So there's different things, but they're not directly causal.
What should a parent do?
So with intellectual disability, basically, the first thing to do is just to step back, just look at the child and just think about how wonderful they are. And then just be patient and understand that, they can learn just like another child, but it takes them longer, and they won't be able to learn. The overall capacity might not quite be as high. One of the stories that one of my colleagues, Steve Warren, likes to tell, and he's a bit older than I am, so he remembers this more than I do. But prior to around the mid-1970s, children, for example, with Down syndrome were institutionalized. They were taken from the parents and put into an institution. And when you see videos of that, what you see are adults that can barely talk, that certainly couldn't read, and so on. And then, with the change and the revolution, and certainly he and many other colleagues were part of that revolution, people with Down syndrome are in regular classrooms. Many learn to read. Many have, jobs in the community. And what changed? Well, the cost didn't change. What changed were the expectations. And so we want to be
Well, just how
fair.
society supports them, right?
Society supports them and so on. Yeah. And so it's important to always remember that. Now, I don't want to overpromise, exactly what's going to happen, because it will take some more time to learn. And some of the things that are part of intellectual disability will persist for that individual's lifetime. And of course, it depends on the severity of the intellectual disability and if there's other conditions. So someone, for example, who has autism and intellectual disability, that means that they have a reduced motivation for social interaction and that reliance on routines, and they learn more slowly. So if a child has intellectual disability and not autism, that means that the way you teach them is going to be not quite as complex. And so the outlook is different in those two situations.
So if you have a child who's born without, let's say, a known probability that there could be a intellectual disability, like
Right.
Down syndrome, right?
Yeah, right.
So if there's no outward signs, where should a parent turn to get help diagnosing an intellectual disability?
So it's kind of the usual process. So normally there's a late talking. That's usually the first sign for all these things. And this late talking could be a stage or a symptom. If it's a symptom, then you would go into, if it's a stage or a symptom, you would have an initial evaluation. Of course, we always want to check their hearing. We have universal hearing screening, but there's still a hearing loss that's missed nowadays. Always do a hearing check. But then you're going to actually, what we do is we look at the language domains, we look at the social domains, we look at the behavioral domains, and then we also look at visual spatial. We do little problem solving tasks. There's actually play sequences, so more sophisticated play. Children with intellectual disabilities will play with their toys in what we might call an immature way. They might do the same thing over and over again. Of course, people with autism might do that too. And so you're kind of looking for these signs about whether the late talking is only in the talking domain or whether it's actually in other learning domains as well. And we have good ways of doing that. But it's really important, and this is something I really want to I know my mom would say, listen with both ears. So listen with both ears. When you're doing an initial assessment of a late talker, you want to actually do a nonverbal assessment to see if it's intellectual disability. What happened with my son was the IQ test that they used was actually verbally based. Because his receptive language was low, they thought his overall learning was low. And that's a kind of a common mistake people can make. On the other hand, I'd done a nonverbal intelligence test, a performance intelligence test with him, and I'm qualified to do that. And so I knew that his learning in that domain was actually above average. And so when they told me he had intellectual disability, back then mental retardation, I knew that they had only done it based on verbal. So listen with both ears. If someone gives you an intellectual disability label, a diagnosis, ask them if they checked nonverbal intelligence, if they test low language, or if it was based on a language test. And they may or may not know that, but even if you go on the internet and you look for lists of nonverbal tests, like the test of nonverbal intelligence, the Leiter National Performance Scale, there's a number of these, the Universal Nonverbal Intelligence Test, there's other ones that you can give. And even in the lower end, there's scales and tests that you can give that are not language-based. And you want to be sure if you get that intellectual disability label that they verify that it's not just based on the child's verbal behavior. That's crucial in late talkers.
Well, how often are children mislabeled with an intellectual disability when it's really something else?
Very commonly. And so I would say, I don't have good data on when a child, is initially diagnosed with intellectual disability, then migrates out of it, because we don't really keep that data as a nation. I think we should. But I'll just say, in my experience, it's not uncommon for that to happen. One of my favorite stories is I had a case on the East Coast, and the young man was initially misidentified as intellectually disabled, and in fact, his thinking ability was actually in the gifted range. And so he went from the intellectually disabled classroom to the gifted classroom.
Skipped right over.
Yeah, he never actually was in the regular program. And it was, again, this idea of he's a late talker, and they tested him with language. And so that was really not the right way to evaluate him.
Do intellectual disabilities often accompany other impairments?
So they do. I think one of the real challenges is so people with intellectual disabilities can sometimes be mistakenly put into the autism spectrum bin. Ironically, the original characterization of autism was in a residential program where Leo Connor, who was one of the first people who described autism, he called it autistic disorder. He noticed that in adolescents with intellectual disabilities, there was a difference in some of them, that they were less social, they were more agitated if you violated routines and so on. And so this difference in intellectual disabilities and autism is what triggered the original characterization of autism. But ironically, because people with intellectual disabilities learn more slowly, and because they have these communication and social programs and are problems and are challenges and are more mature, they sometimes get mistakenly put in the autism bin. And then like kids with Down syndrome, many of them, for example, have ADHD. So you got to and many of them have speech disorders. So you really are looking at a multifaceted situation. But there are a lot of kids who, other than the fact they learn more slowly, there's not really anything grossly different in terms of their
specifically about a child who might have multiple challenges ahead, right? So a child with Down syndrome who might have an intellectual disability also might have some speech impairments. Where do you start? Which road do you go down first to start treating?
So that's where the real expertise comes in. And so basically the clinician has to have this overall perspective about what's the most important thing for me to be teaching right now with an eye towards the future. And so, for example, if a child's speech is unintelligible, that might be a pretty high priority, because when a child's speech is intelligible, then they're eliciting teaching responses from the environment, because parents are going to respond to them. Like if a child says something, the parent's going to name that object and then they're going to elaborate on it, which gives the child a lot of knowledge. Well, if the parent didn't understand what they said, that can derail that whole teaching process. So that might make it a big priority. But if a child is saying a W for R and you can otherwise understand them, then the speech disorder is going to be really a low priority. So somebody has to, your clinician has to be thinking about all these different things and saying, okay, what's the most important thing that I need to be working on in this moment, and how is it going to lead to other teaching? I was part of a Institute of Medicine, National Academy of Science working group, and we produced a document that was reported to the Social Security Administration and then was also presented to Congress. And it was that in America, what happens is that people are trying to keep all the kids on grade level. And then with a child with intellectual disabilities, you want to be very thoughtful about what you're teaching them. You have to prioritize. You have to triage. And so, certainly, language, vocabulary, basic conversation skills, things that allow the person to participate are really a high priority. Doing things like having kids do a lot of worksheets, may not be the best thing. I remember one case with Down syndrome. I was in third grade, and they had spent Herculean efforts to have this child memorize their times tables. And that was just like, actually, I know that young man. He's now in his 20s, and I taught him to use a calculator like 15 minutes. It's like we spent a year on times tables. That took the place of other learning that would have been way more beneficial to that young man. And so we need to in a case with intellectual disabilities, more than anything, we have to be really focused and really mindful. How am I teaching this child in a way that's going to help them and give them skills, not just today being with their classmates, but 5 years, 10 years, and how am I building an adult that's capable? And so we have to really be focused, and we can't waste their valuable learning time is what I'm going to say. And so we have to think about, what do I need to be teaching this child? And because it takes longer to learn, that learning time is very valuable and should be done very mindfully. We can't waste their time. Is there a
fear associated with the label of intellectual disability just because of the longstanding stigma surrounding it?
There is. Again, I think in a way I'm maybe a little unusual in the sense that I just see every person as a person and they're not a label. And I really want to encourage children to just see, who they are. And I know you just did an interview, and people may want to, think about listening to parents who's been on that journey, or children who may have had a little bit different learning profiles. But the idea here is that you just have to really set that aside, and it's not the person. Down syndrome, I mean, you're just not going to meet a more engaging, really wonderful set of people than people with Down syndrome. And so defining them as a label is just really, you're going to miss, and it's just a lot of important experiences and a lot of important life lessons if you try to put people in a bin that way. So I do understand that there is this idea, and I certainly see it because the late talking can be a symptom or it can be a stage, and in a stage part, you see these rapid growth types of things, and that's really encouraging, and we see that. But if it's a symptom, it's still a wonderful human being who's on their journey, and it's going to, like when I'm in the Down syndrome clinic, I would tell parents, this child's going to bring you more joy than you can imagine. I know right in this moment, I was seeing him at the 1-year visit, you're overwhelmed by everything. And parents came to me 10, 15 years later and said, you know what, that was the most important thing I heard when you were talking to me. So I do understand it. It is something that means you're working and that the child's progress is going to be slower across different domains, and that can be a little disheartening. But if you let go of that, then it's just, roll up my sleeves and teach this child what they need to know in order to be an adult. And they will. And people with intellectual disabilities absolutely can learn new things, and you just want to be sure you're optimizing that learning because it has a high value.
How do you support them beyond the school age years?
So that's a really important question, and one that our country is finally starting to take on in a bigger way. And so what happens is that our schools, our delivery systems have the early intervention, preschool and school services, and then people age out of that when they get to be in their early 20s, 21, 22. And there hasn't been a lot of planning and a lot of thought around,
what's next?
What's next? And I'm saying we need to do that starting in early school age at the latest, and think about how we're going to align our teaching. And we're not putting a straitjacket. We're letting the child set the bar about what they can learn and how fast. We're not limiting it up front, but we're saying, okay, this is our highest priority. So for example, I think it's really important for our people with intellectual disabilities to have, basic reading skills. So I'm going to work on reading, but I'm not going to spend a lot of time doing esoteric types of decoding things. I'm going to teach reading comprehension at a very early level. I'm going to get a vocabulary inventory. I'm going to teach them to read words that they already know. I'm going to teach them to read whole words. I'm going to teach them to read safety words, and I'm going to teach them how to read words that may help them, for example, take public transport. I'm going to be thinking about what I want this child to learn, and I'm going to start early.
Yeah.
Life skills itself has a negative connotation. It's like people say, oh, I'm in life skills, and it's like a defeat. And
how is that a negative connotation?
Well,
I think it's like one of the most important things that we all
No, exactly. And it's, again, I think that what we want to think about is, building a capable adult is how I would phrase it. And I mean, it is life skills. It's just that now life skills has a negative connotation. And frankly, what happens
I missed that boat.
Well, no, but what can happen in life skills classes is that it becomes kind of a glorified daycare where the basic needs are met. And I appreciate that and I applaud it. But maybe people aren't thinking about, okay, how am I going to feed into transition? And there's fantastic life skills course. I don't want to paint that with a broad brush, but there's certainly programs where there's this belief that a child stops learning after they get to be about 10 because of a misunderstanding critical period, and then they kind of quit teaching. They just take care of them, which I'm glad they're taking care of them, and that's good. But we still want to be teaching and moving the child forward.
We're still learning. I feel like
I like to think that.
Yeah.
I'm certainly learning new things all the time, for sure. And I'm 65 and a half and still very excited about what I do and learning lots of new things. So that's true.
I won't say how old I am, but I'm still learning.
No, you're not. You're not
still
supposed
learning.
to. So one of the things I have learned is that, it's important to say you're younger than I am. So you're definitely younger than I am. So
it's true. I won't argue with that.
Right. It's certainly true.
Is there anything else that you want parents to know, that if your child is diagnosed with an intellectual disability, what kind of words of encouragement, support do you have for them?
So number one, child has intellectual disability. It just means they're going to take more time to learn. And you don't need to think of it as destiny. You don't need to think of it as the videos I mentioned where you have these adults in diapers who really just need rudimentary care skills, and that's as far as their life is. Not that at all. And also, it just means that you have to be more thoughtful and mindful about what you're teaching because it takes longer. But you can teach them. It's just that you want to work with your team and you want to be a good advocate for your child. And you also want to start thinking about, well, how do I envision this child's life being when they're a teenager? How do I envision their life being as an adult? What kinds of jobs do I think that they might enjoy? And you have that conversation and you think about it. And so in that situation, then you have your, I call it the North Star. You've got your eye fixed on the North Star. So the fact that, for example, that third grader with Down syndrome who couldn't do his times tables, you're not pushing the panic button about that. You're saying, is it really important that in this moment I teach them the times tables, or is it more important for me to teach them additional vocabulary, or do I want to do initial reading vocabulary? How do I want to use their valuable learning time? And you just want to be very patient, very positive, and very supportive, because these children are going to learn so much more than people initially imagine that they will. And again, it's that example from Steve Warren, these kids that were institutionalized, weren't taught things, how that turned out versus, how things are evolving now, where people are learning so much more than we ever imagined. And with, technology, and as we learn more, I just think it's only going to get better and not worse. So there's a lot of optimism, a lot of hope. Main thing is, don't see that child as a label, see them as your child. And once that happens, so many good things are going to come along.
Support them, encourage them.
Yeah, just do the things that the parents do. Yeah.
Thank you, Steve. This wraps up our conversation on labels. So if you missed any of the previous episodes, no problem, because they are archived here wherever you are listening to this podcast. And we look forward to having you back again. Join us for the next week. Of course, we're working on great topics all the time, aren't we? You can ask us questions. We'd love to answer those. Leave comments. Click subscribe so we can keep getting information your way. Always hit that bell. And of course, you can go to the Late Talkers Foundation website.
Remember, the best thing for your child is you.